Hello everybody, Jeremy Latham here. I'm the hip surgeon. By the time people come and see me, they've often had symptoms from their hips for a year or two. They've tried the usual things like painkillers, a walking stick, slowing down and giving up the activities which aggravate their symptoms. There's some interesting evidence emerging about the more general aspects of how arthritis of the hip and knee might affect your health. I've put together a short presentation summarising some recent evidence. I hope you enjoy it. If you have any questions or comments, please do get in touch, either through the website or via my secretary Anne. The details will follow at the end of the video. Thanks for watching. There are worse things in life to have than an arthritic hip, but it's pretty miserable nonetheless. It gets in the way of everything, and even doing the simplest things like washing and dressing becomes increasingly difficult. This X-ray shows why the hip is stiff and painful. There's bone rubbing on bone, the muscles waste away. You'll be told to lose weight, slow down, take painkillers and anti-inflammatories, but try to stay as active as possible. This is a pretty tall order if you're feeling fed up and miserable because your hip's sore, you're tired because you don't sleep very well, and you're getting increasingly grumpy because you can't do the things in life that you enjoy. If that wasn't bad enough, there's some even more depressing news which has just come out from a conference held in Liverpool recently. It shows that if you've got a painful, stiff hip because of osteoarthritis, there is an increased risk that you'll die within the next 10 years compared to somebody who doesn't have a painful, stiff hip. The longer it goes on, the worse it gets. It's hardly surprising, is it? Taking drugs, slowing down and getting unfit makes everything worse, particularly if you've got diabetes or high blood pressure, or are putting on weight. The authors of the study have pointed out that surgery isn't without risks, and that's not surprising either. Surgery, of course, carries a risk of complications, some of which can be life-threatening, but hip replacement's a very good operation. Over 100,000 a year are done in the UK, and the outcome for most people is excellent. If you have a hip replacement, the chances are you'll be mobile and getting fit again within a few weeks of surgery, and it will certainly put a spring in your step. You won't need to take as many painkillers, and you'll find big improvements in your health and general outlook. It might even make you live longer. Well, I hope that you found that interesting. It fascinates me that something so straightforward as osteoarthritis of the hip, such a common disease, can have such a profound effect on people's general health and well-being. If you've got a problem hip, please get in touch and let me see if I can offer you some advice. Thanks again for watching. I'm Jeremy Latham, and I'm the hip surgeon.